Welcome to the Teeth Chatters podcast, where we chat all about the correlation between oral health and systemic health. My name is Sarah Giuliano. I have been a registered dental hygienist for over a decade. Now I'm about to branch out from the dental chair into the community to all you beautiful, amazing people. Together, we can connect the body to the mouth through educational podcasts. So let's get this show started. So what is hyaluronic acid? And what's all the hype about it lately? Being a middle-aged woman, I am all about radical self-care. This includes skincare, nutrition, exercise, as well as my mental health. But being in my mid-40s, I do keep up on all the latest and greatest skincare ingredients to keep my skin looking fabulous as I age gracefully and ever so slowly. During my current research on oral and systemic health, I stumbled across some great research articles that focused on hyaluronic acid. So I had to dive deep into this because I learned all the amazing benefits hyaluronic acid has, not only on your oral health, but amazingly as well on your systemic health. And that's the cherry on top, guys, your skin health too. So I wanted to do a brief, fun podcast today, everyone. And who better to invite on as my frequent, recurrent guest, but none other than my steady podcast partner, Indi. Hey, Indi, how are you?
Hi, Sarah. How are you?
I'm doing well, thanks. Thanks for coming back again.
Oh, thanks for having me. It's always fun to be here.
You're becoming one of my besties.
Yeah, I know. I know. The last podcast we did, we were going to change the name to the podcast.
I know. It was going to be Indi's podcast.
It was going to be under my name, yes. Yes.
Well, with you being on as such a recurrent guest, that just might be one of these days.
I think we should. Absolutely.
I also think you should be on the Teeth Chatters logo as well. So when everybody sees my face, they see yours too.
I don't know if we want to. I don't know if we want to go there.
Oh, I'd love to.
No, let's not go there. We might scare some people away.
Oh, as if my picture doesn't. Okay, so anyways, I just want to say thanks for coming back and spending time again with me, doing another podcast. And you are such a great guest, so we always have a lot of fun. So it's like, let's enjoy it, you know?
Right. Well, that's the whole point, right? We want to educate people, but also have fun while we do it.
Right. So anyways, you're a guy. So I'm not sure if you want to get into skincare products that contain hyaluronic acid, but I do have a question for you. Do you know or have you ever heard of hyaluronic acid?
Believe it or not, I have.
You have?
Yes.
Cool.
The company that I currently work for, we do have a product. Mm-hmm. It's an oral spray.
Okay.
That alleviates dry mouth.
Okay.
And one of the main ingredients is hyaluronic acid.
Okay.
And as you know, there's so many benefits utilizing hyaluronic acid in some of the beauty and healthcare products. And I'm sure that we'll talk about it later on today. Yeah,
so when I was doing my research on oral and systemic health, when I came across some research on hyaluronic acid, I personally have never known how beneficial it is to your systemic health, too. Right. I did know, certain things for oral health being in the dental field, but I never knew how important it is to actually have substantial amount of hyaluronic acid in your body.
Right. It's very important, honestly. And if you look into the anatomy, the human body utilizes hyaluronic acid.
Right. It produces it. It's
extensively,
great.
Yes,
right.
Absolutely.
Okay, so we ready to dive deep into this?
Yeah, let's go.
All right, let's have a convo.
Let's have a convo.
Do it. So hyaluronic acid, everybody, is a clear, gooey substance that is naturally produced by your body. It's known as a humectant, and that means it retains moisture and water. So hyaluronic acid is naturally found within the synovial fluid of the joints, your skin, your eyes, and the connective tissues of the body. Hyaluronic acid's main function is to retain moisture and lubricate in the body's tissues.
Yes.
So that's why it's so important to the body, because you want to have that fluidity and keep everything flowing and going.
And we talked about hyaluronic acid in some of our podcasts too.
Right.
Especially the rheumatoid arthritis.
Yes, absolutely. And, unfortunately with rheumatoid arthritis and autoimmune disease as well as Sjogren's disease, unfortunately, that hyaluronic acid is depleted in the joints, and that's where a lot of the inflammation and pain comes from.
Exactly.
First, let's talk about systemic health. So, as we age, our bodies change as well, and the hyaluronic acid production may start to slow down and reduce. If you are suffering from autoimmune disease like we just talked about, Sjogren's disease or rheumatoid arthritis, hyaluronic acid reduces in function, and this may increase the swelling like we just talked about in the joints and the connective tissue. And it can also cause dry eyes, dry mouth, and dry skin, dry hair. So like I said, anywhere hyaluronic acid is present in the body, it's depleted, especially with those autoimmune diseases, and unfortunately you start to dry out.
Right. It's painful, and your quality of life kind of gets worse,
Right, because if you don't have that fluid around your synovial joints, that's where you get that lymphocytic infiltration, inflammation, and the pain.
Right, exactly.
So that's why let's talk about systemic health. Okay,
right.
Here we go. All right. So, number 1, this is a cool one. Hyaluronic acid promotes healthier, younger looking skin. All about it. Love it. I swear I'm going to keep myself looking 40 when I'm 80. So over half of all the hyaluronic acid produced in your body is located in your skin. So hyaluronic acid binds to water in the skin to retain the moisture. So facial creams that contain hyaluronic acid are great in maintaining healthier, younger, softer, supple looking skin. So even doctors and dermatologists now are using hyaluronic acid injections in the place of Botox. Now, I never knew that.
I never knew that either.
Right.
That's very interesting.
It is, because it's safe. So the benefit of this hyaluronic acid is it is safer because remember, your body naturally produces this. Hyaluronic acid injections reduces wrinkles, keeps the skin smooth, reduces fine lines. It's recommended that for best results and efficacy of hyaluronic acid skincare products is to have hyaluronic acid injections over the creams or the serums. So that's where you're going to get the best results is if you do that.
Okay.
But obviously the creams and the serums are as beneficial
They're more
as well.
popular, if you will.
It is.
A lot of beauty companies have
do.
At least one moisturizer that has hyaluronic acid.
Yeah, and after doing all this research, I definitely went out and bought hyaluronic acid serum for my face. Of course. Are you kidding me? So another cool thing, hyaluronic acid supplements are also a great addition into your vitamin regimen. So doctors recommend anywhere between 120 and 140 milligrams of hyaluronic acid to be the recommended daily dose. And that is a very low dose. And you can include that in your supplement intake just to, like I said, as we get older, we don't produce hyaluronic acid as much.
And I remember you saying that you actually started taking hyaluronic acid, correct?
I did. Like I said,
How do you feel about it?
I feel great.
Any difference that you've seen?
And I know that we had talked about this before. I'm a big runner, and I have been running for over 30 years. And now that I am creeping up, I will not actually give everybody my exact age.
I think you did actually earlier.
Oh, goody. Then go listen to another podcast because I'm not repeating it. But now that I'm creeping up into my mid-40s, I do get some joint pain. And I do know that that's wear and tear on the body. So I have been taking hyaluronic acid supplements for the last few months.
Okay.
And I'm going to be honest with you, in conjunction with that and doing like a turmeric supplement with curcumin, I feel good.
Okay.
I feel good.
That's good.
Yeah. So
that's very good.
For me, it works. And I do love to run. And I feel like why not add that to my daily regimen and help increase my health?
Good.
So another one. Here's another cool systemic tip. So hyaluronic acid, and I just found this out recently, helps wounds heal faster by regulating inflammation levels and signaling the body to build more blood vessels in the wounded areas. I never knew that.
I never knew that either.
Right. So hyaluronic acid is the main component of extracellular matrix and is considered one of the key players in tissue regeneration.
Wow.
Yeah, so it's been proven to modulate via specific hyaluronic acid receptors, inflammation, cellular migration, and angiogenesis, which is blood vessel formation.
Okay.
And these are all the main phases of wound healing.
Wow. So then would you recommend, and I know you might not have the answer for this, but this is, I guess, just a natural question.
Sure.
After this statement, would you recommend a cream with hyaluronic acid to be placed in a wound?
Absolutely, I would.
Really?
Yeah, I definitely would because, again, this is my takeaway when I did all my research on that. It's a natural product in our body. I like to try and promote things that I know are closest in nature to who we are.
Right.
Why not?
Yeah.
You know what I'm saying? If you know that that's clinically proven to do and there's evidence-based research on that, why not?
Yeah. I mean, I would definitely say to the listeners, do your research and
Sure, and consult with your physician prior to changing anything. And we do always say that in the podcast anyway, because you should. We're just giving you cool, relevant information. You could take it for what it is, but this is all evidence-based research.
Right. Perfect, yeah.
So here's the other thing as well, and we are going to actually do a spin around and come back to that wound healing because I have some other cool stuff. So another cool systemic benefit is hyaluronic acid also has antibacterial properties. So it can help reduce the risk of infection when applied directly to open wounds.
I see.
Okay, you see where I'm going with this?
Right, yeah.
So a clinical application of hyaluronic acid membranes or gels or sponges during a surgical therapy may reduce the bacterial contamination of surgical wound sites, lessening the risk for post-surgical infection and promoting more predictable regeneration. So it reduces the bacteria level, but it also promotes healing.
That's crazy.
So doctors are actually using it
after surgeries.
Yes.
Wow.
For wound healing to speed up the process and also as an antimicrobial.
Wow.
So it's great.
That is great.
Right.
Think about it.
Yeah. I mean, like I said, that's why I wanted to do this podcast because I never knew this.
Yeah, I never really. So I knew that your body naturally produces hyaluronic acid.
Right.
And it's mostly found in all the joints in your body.
In your skin, right.
Yeah. The benefits of it as far as systemic health and oral health, we have touched on it a little bit, as you said, but really not in depth this much.
And, you know, I have to be honest with you, doing all the research that I did for the previous podcast when we did, you know, Sjogren's disease, rheumatoid arthritis, and even in blogs that I had written about arthritis and autoimmune diseases, I never knew all the systemic health benefits of hyaluronic acid.
Right.
And that's why this is so cool. So here's another one that we're going to just lead off here. So doctors are actually using hyaluronic acid injections, and they're utilizing in areas where the cartilage and synovial fluid has worn down due to arthritis or wear and tear on the joints. So they're using that in replace of cortisone injections.
Oh, wow.
So it's great for those patients who have osteoarthritis.
I see.
So they're getting that bone on bone, that wear. So what they're doing is a lot of doctors now and orthopedic surgeons, instead of giving cortisone injections, they're doing hyaluronic acid injections.
Right.
And they're having good results.
Just to kind of save them from that knee replacement.
Exactly. I notice doctors are becoming more conservative with things, and they want to try and preserve what's there before they actually have to take something out and put something artificial in.
Well, yeah, of course, because there's risks of
your body rejecting it because it's a foreign substance.
Exactly.
Why not try to improve in what's already there?
Exactly.
So it's almost like giving your joints a hyaluronic acid boost.
Yeah. Well, it's
cool.
I mean, you need every morning. You need it. You need water to wake up, get your body going.
Right.
Your joints need the hyaluronic acid too, so why not?
Yeah, that's what I say. Pretty soon, man, if they find a hyaluronic acid beverage, I'm going to start drinking it.
Honestly,
I'm all about it after all this.
Honestly, if you do some research, you probably might find one.
I know, right? Okay, so here's another cool one. Research shows hyaluronic acid supplements may help reduce symptoms of acid reflux. Now, there's another one I never knew.
Wow.
Yeah, so you know people get that acid reflux, that upchurn of the acidity from the stomach acid comes up and causes erosion in the esophagus. So hyaluronic acid will coat the lining of the esophagus and soothe the esophageal lining from the acid uptake and burning. Doctors are recommending that, you know, if people are going to do hyaluronic acid supplements, if they do have acid reflux, to use it in conjunction with their acid reflux medication.
Wow.
Right. It's not eliminating acid reflux, but it's taking away that burning in the esophagus.
And erosion, yeah.
Yes.
Yeah.
Again, that's super cool. Isn't this awesome?
Well, I'm sitting here and listening to you and some of these great effects that hyaluronic acid has in your body.
And we haven't gotten to the oral health yet.
I know,
this
but I'm sitting here and I'm like, hey, maybe I should start taking some hyaluronic acid pills. No, because sometimes I do get acid reflux, and it's not
after a bean burrito.
Yeah, after a bean burrito or spicy food and all that, spaghetti with sauce and But why not try it?
You know, it can't hurt.
Right.
And that's my theory. And I think why not, again, as we age, our bodies do not rebuild and restore as they should.
Yes.
And we know that things break down over time in our body. Why not just give ourselves a little bit of a boost?
No, yeah,
and it can't hurt.
Getting up in the morning, it's getting hard. harder and harder.
Exactly right.
Okay. But if you sit, here's
I
another.
know, the sitting.
You have a job that you sit all day and from 8 to 5.
Right.
You really are not moving much.
Nope.
And as you say, this is a saying that Sarah says, everyone, motion is lotion.
Motion is lotion, everybody.
So you might need that supplement.
Yeah.
Because you're not moving. You're sitting 8 to 5 on a desk.
Right. And then you get up at 5 o'clock to get ready to leave, and you're like, oh, I'm sore. My knees hurt.
Everything
my back hurts. My shoulders hurt.
Yes.
Wait, why does my back hurt? Well, because I've been sitting all day.
And it gets worse as you age.
Exactly.
Right.
And you're what, 48?
Yes.
Oh, God. I'm
Getting there. Getting there.
Just to let you know, Indy's way older than I am.
Yes.
Okay. In spirit, I'm much younger. Okay, so here's another cool one. You ready?
Yes.
Okay. So hyaluronic acid is great for dry eye symptoms. So in addition, hyaluronic acid eye drops are frequently used during eye surgery to reduce inflammation, because remember, it's anti-inflammatory, antimicrobial, right? And it helps aid and speed up wound healing. So hyaluronic acid is used for treatment of cataracts, cornea implant surgery, and dry eye symptoms associated especially with Sjogren's disease patients.
Yeah. I wonder if there's an eye drop with hyaluronic acid.
I believe that there is. When I was doing my research, I did come across
a specific brand.
Yeah, and I did see it was more for dry eyes.
Yeah.
And I cannot say that word, like the medical word. We'll try it. Here we go. Xerophthalmia. That's the medical word for dry eyes.
I see. Okay.
Anyways.
Yeah, but
don't quote me on that.
Don't quote me on that.
But it sounded good.
Well, you are known for mispronouncing words.
Okay, everybody. Indy is way older than me.
Yeah. Nice. Nice.
Okay, are we ready? Got another one. So yeah, anyways, by the way, that's really cool for dry eyes,
That
right?
is,
Yeah.
yes.
So researchers are finding that hyaluronic acid supplements may help slow the rate of bone loss and osteopenia. So osteopenia is basically the precursor to osteoporosis, okay? That's basically the beginning stage of bone loss that precedes osteoporosis. So this thus far has only been tested on animals. So this is why I'm just including it. But researchers are hopeful and continue their research. And they're finding that hyaluronic acid promotes osteoblast cell formation. So osteoblast cells, actually what they do is generate new bone.
Wow.
So this
That's
to
very
me,
interesting.
Yeah, and you know what's really cool when I was researching all this stuff? This is all super relevant. It's late 2021, early 2022. So this is a hot
great
topic.
Great information to know too.
Right.
For a lot of diseases that, one of the main.
Yeah, I look at anything where you have like the joint pain or Sjogren's or rheumatoid arthritis, dry eyes, dry skin, or you just want to use a nice cream, you know, to help slow the aging process down. Come on, guys.
Yeah, I mean, I'm
really?
48, so I need
You
to
are
slow
48.
down.
He's going to kill me.
I'm going to get your driver's license one day and just going to post you on your website.
I just want to let you guys know Indy will probably never do another podcast with me after this. Or he's just going to go around all over social media and tell everybody how old I actually am.
I will find your birth certificate and blast it out there.
Okay, so let's be honest. I have to let you all know Indy is, 11 years younger than me, so he is younger. So there. Okay. Oh, stop
now
it.
Now you're trying to redeem yourself.
I am, because I don't want him to, blast me all over social media.
Oh, stop it. I would never do that.
Or would he? Okay, here we go. You ready? Another one.
What's another one?
Okay. Scar formation in surgical wounds can be prevented by the administration of hyaluronic acid during surgery.
Right.
That's crazy.
Yeah.
That's wild. So hear me out. So in the case of burn victims, there was a systemic review done on burn victims from the ages of 18 to 80. And here's the results according to the Journal of Nursing School from their study. And I want to say this, guys, and I'm going to quote this.
Okay.
So hyaluronic acid demonstrated superior compared to other covers utilized to treat burn wounds with respect to shorter time of wound healing and histological characteristics such as improved elasticity, higher microvascular density. So when hyaluronic acid is applied in wounds, there is improved water retention, which favors a suitable environment for the formation of collagen and elastin and allows the cells to proliferate and differentiate, accelerating the healing process. So, furthermore, the anti-inflammatory properties of hyaluronic acid influence the healing, preventing the conversion of wound and formation of hypertrophic scars. Another word for hypertrophic scars is erased scar tissue.
Okay.
So people that have had severe burns,
Right.
they're using hyaluronic acid wound patches to actually help speed up the process and help reduce as much scar tissue.
Right. Yeah.
I think that's great.
Yeah. I mean, it's great in multiple levels.
Absolutely.
For surgeries, for accidents, you're cutting yourself while you're cooking or doing
Sure.
something,
Yeah, so I actually found that fascinating, so I wanted to share that with everybody.
I wonder if it's beneficial to use it afterwards too, or no, it might be too late.
After what?
After your scar is healed.
I would think that it would be because, again, it is a natural anti-inflammatory, antibacterial. So what I'm looking at it is I remember when, so we'll get a little off topic here. I remember when I was pregnant for my oldest son, like I always would rub cocoa butter on me so I didn't get, stretch marks and scars
Yeah.
and things like that. And it helped. I never had any. And I'm wondering if hyaluronic acid creams and ointments may have that same benefit, just because it retains moisture.
Right.
And prevents that drying out and stretching of the skin.
Yeah, that's very interesting.
Yeah. Okay, you ready? Couple more systemic ones.
We have a lot more.
Well, I mean, a couple more systemic health.
I know. I mean,
This is fun.
we have to.
What?
You said it like you were trying to convince someone. Hey, this is fun. You're having fun, right?
Everybody having fun? Come on, tell me you're having fun, everybody. Say it, say it.
I'm fine. I'm fine.
I'm good. I'm okay. God.
You said it with the same level.
Okay, here we go.
All right.
Systemic health benefit number 800. Here we go. Hyaluronic acid has also been explored in the field of tissue engineering because of its significant role during organogenesis. That means organ formation and cell migration. That's crazy.
Okay, so explain it to me. What were you trying to say?
So, okay, the field of tissue engineering, basically growing tissue. Wow is right.
Yeah.
That's crazy.
That is crazy.
I never knew that.
Yeah.
It's crazy.
There's more benefits, right?
Yeah, there's a lot more.
Yeah.
Okay.
What's another one?
So I just have to say, like, the whole, tissue engineering, like, that's crazy. That they're using hyaluronic acid is part of their field of tissue engineering. So researchers are realizing they can grow tissue using hyaluronic acid in
still
conjunction
in the
with other
research
cells.
level, though, correct?
Right, but
Okay.
still, that's crazy.
Yeah.
So hyaluronic acid patches and gels are now being utilized on diabetic patients. And that's for post-operative wound healing. So you know that people who have diabetes,
They have a hard time
healing,
Right.
even a cut, or even after like post-surgery, because they have weakened immune systems,
Right.
and their healing response is much lower. So hyaluronic acid has great healing properties, as I previously mentioned, and that's why they're using hyaluronic acid patches on diabetic patients after, so they help aid in the wound healing.
Yeah, that's great to know. I mean, I know someone personally that the doctors were debating who was diabetic, by the way. Mm-hmm. The doctors were debating if it would be beneficial to do the procedure and run into the risk of the wound not healing completely, or leave the procedure, and at least the person is not running into that issue.
Right.
But now knowing that hyaluronic acid patches might help with that,
Sure.
I mean, that's a great thing to know.
Yeah, I agree. And it's just, I look at it this way. It's a natural substance produced in your body. It can't hurt to try, to at least see if it can help.
Right.
Okay, here we go. Another one. Hyaluronic acid levels promote and increase anti-inflammatory cells and fibroblast formation to promote and retain moisture and increase collagen and elastin formation. High hyaluronic acid levels. So if you have a higher amount of hyaluronic acid, low levels of hyaluronic acid promote inflammation and breakdown of fibroblasts, which will increase cytokine production. Remember the cytokines?
Yeah. We on periodontal disease.
Right. So if you, like in the case of Sjogren's disease and rheumatoid arthritis, they have lower levels of hyaluronic acid, and that's where the inflammation increases because they don't have that lubrication around their synovial joints to help increase the fluidity, increase the immune cells to really help heal those areas. So that's why it's important to have proper amounts of hyaluronic acid levels. So Okay, so what do you think of that? Those are all the cool systemic health benefits I found.
that's. I mean, those are a lot.
It's a
honestly.
ton.
If you think about it, we were able to find out, and researchers were able to find out that you can use it for so many issues that you may have.
Right.
From just having dry eyes, to helping skin.
Yeah, joints.
Yeah.
Acid reflux, wound healing.
Right.
Osteopenia, think about it.
Cell generation.
Yes, it's crazy.
It is crazy.
And now that they're also using hyaluronic acid to help promote in tissue engineering, I mean, that's great. If somebody needs like a skin graft, that's great.
Yeah.
That's huge.
It could help a lot of people.
Absolutely. So I just want to say, guys, that's why hyaluronic acid is so important to your systemic health. So we are going to take a quick little commercial break here, and we are going to delve deep into the oral health benefits of hyaluronic acid. I hope so far you all understand how important hyaluronic acid is. Not only is it overall great for you, but there are also so many benefits for your overall health. Hyaluronic acid may help relieve discomfort caused by dry mouth symptoms. Some symptoms include dry throat, difficulty with chewing, talking, or swallowing, and in general, just a low salivary production. Low levels of saliva can leave your mouth susceptible to bacteria and other oral health complications. Lubricity is a premium dry mouth spray that helps soothe the oral cavity and relieve dry mouth symptoms. It is the only over-the-counter spray that contains hyaluronic acid, which, as we all know, is great for dry mouth. If you're interested in learning more about Lubricity, visit lubricityinnovations.com, and you can use coupon code POD20 for 20% off your order. That is POD20 at lubricityinnovations.com, and you can find the link in our description. Okay, so here are some oral health benefits of hyaluronic acid. Now,
favorite part of the podcast.
Of course, everybody. Come on, what's this podcast about? Oral systemic health, but we love oral health. Come on. Okay, so you had mentioned earlier that you know quite a bit about hyaluronic acid.
Right.
So
well, we
let you talk about that.
I mean, we talked about it in so many other podcasts too.
Sure.
We talked in the podcast in regards to the Sjogren. We also talked about it during the rheumatoid arthritis, and everything was correlated together, and it all started in your mouth.
Yep, absolutely.
Yeah. So, and me working with the Sjogren Foundation, also working for a company that one of the product is a dry mouth oral spray, I had to learn about hyaluronic acid in general and also dry mouth.
Right. So let me ask you a question now. What do you feel, coming from an oral health perspective, causes dry mouth symptoms?
Oh, there's so many issues that start causing dry mouth.
Right.
As you know, a lot of medication
absolutely
cause dry mouth. And I think you did a podcast on that, or not yet?
Not yet. It's to come.
Oh, I'm sorry. I spoiled. Spoiler alert. I apologize.
Yep, Indy's cut. He's banned after today, everybody.
Spoiler alert.
Spoiler alert. That's okay. No, you're giving everybody a sneak peek. We're going to do one on that. That's up and coming in the next month or two, guys, so stay tuned.
So, you know, there's a lot of medications that cause dry mouth. As we talked about, Sjogren's disease causes dry mouth.
Sure.
Having sleep apnea.
Oh, yeah. That's a big one. Yep.
I just talked to someone today who's using a CPAP machine, and he's having trouble with his dry mouth, and it's hard to even keep the CPAP machine on all night. So,
sure. Because naturally you want to take that off your face. I know some people, I've had patients say to me, it feels like it's claustrophobic, but yet it's so beneficial for people who had sleep apnea.
But you also move. I mean, if you're one of those people that move a lot during your night sleep, it moves. It's just going to get off on its own, even if you don't mean to.
Right.
But smoking causes dry mouth.
Sure. Smoking cigarettes, smoking marijuana, cotton mouth, we know
everything,
that. Right.
Yeah.
Sure.
And the main one that we've talked so much about is periodontal disease.
Yes. Yes. So periodontal disease is huge, and we have touched on this in so many different podcasts. I think one podcast we really delved deep into periodontal disease. So when you have a low salivary flow from dry mouth, and we've talked about this before, we'll just touch on this for a second, and you don't have that first line of defense with that salivary flow that you need, what happens is when your oral cavity is dry, it increases inflammation in your mouth, and it makes you more susceptible to periodontal disease. And periodontal disease is basically a breakdown and a destruction of the periodontium, which is the connective tissue, the ligaments, and the joint that actually supports the tooth in the bone. So it's critical to have a good salivary flow. So if you are on some medications or you have systemic health issues or diseases or autoimmune diseases, it's really important to do everything that you possibly can to make sure that you can at least get some moisture in your oral cavity for that benefit for your oral health.
Right. No, absolutely. I mean, you have to.
Yeah.
And there's plenty of products out there in regards to dry mouth, but we're talking about hyaluronic acid right now, and it helps a lot. Hyaluronic acid helps a lot with dry mouth.
So actually, I've been in the dental field for 13 years now, and I knew hyaluronic acid was good, but I didn't realize why. So everybody bear with us a little bit because it might get a little deep at times, but we'll kind of lighten it up. So I just want to get into this a little bit here. So you ready with the oral health part? So hyaluronic acid has been identified as and is present already in your periodontal tissues. Now that I didn't know. I didn't realize that you actually had hyaluronic acid in the tissue that surrounds the periodontium.
I think we talked, actually, you might not remember, but I think we talked about it during our CBD podcast.
Okay.
I might be completely wrong.
Oh, but you could be right.
I think that was the podcast that we went into deep details about the periodontal disease, and I think
we had to break it up into like 2 parts.
It was so long, right? Yeah, absolutely.
Sorry, everybody. Some of them get long.
No, it was so long we had to split it up in 2, but... No, I think that was one of the podcasts that we, one of some of the research that you had done, because we were talking about periodontal disease.
Yeah.
You had found out that hyaluronic acid is already in the periodontal tissue.
Well, let me just say this. I think you just redeemed yourself, so I guess I will allow you at some point to come on as a guest because I didn't even remember that.
Yeah.
So good.
Well,
hey, you listen.
I was in that podcast.
Thanks, Indi.
You see, I was listening.
Yes, you were. Okay, so you're keeping me in line. Thanks. So I just want to say where hyaluronic acid is most prevalent. So it's going to be in the gum tissue, in the periodontal ligament, and the sulcular crevicular fluid. So that's basically below the gum line, guys. Okay, so that's basically what we're talking about. So hyaluronic acid, along with its viscoelastic properties, so that means that the thickness of hyaluronic acid, okay? Hyaluronic acid is a bit thicker. It's not like water. It's a bit thicker. And that's the benefit of it because hyaluronic acid, having the thickness it has, can actually help. It attaches to cells easier. So in the presence of the sulcular crevicular fluid, hyaluronic acid can attach to the cells and contributes to slowing and reducing the flow of foreign bacteria and aids in the prevention of periodontal pathogenic bacteria. That's why hyaluronic acid is so important to have in your oral cavity. It helps, remember, it's an anti-inflammatory and an antibacterial. So if you have a low salivary flow and you don't have as much hyaluronic acid, you need to use something that's a substitute in that case.
Help with it. Yeah,
right.
Absolutely.
So it's an essential component of the periodontal ligament matrix. So the ligament is actually what wraps around the roots of the teeth and connects the tooth to the bone. And it also allows us to chew and eat and talk without our teeth breaking. That's where that ligament kind of can move and flow a little bit. I've had patients come in before and they're like, oh my gosh, I bit down the other day so hard and I felt like my tooth broke. And I always would say to them, it's actually like a sprain. It really is. Do you ever like bite down on something and like it hurts so bad in a tooth and it's like goes right through you like a jolt?
No, I've never actually, that never happened, but this is what happened to me. And I might not remember it right, but I was drinking water. And I had this huge pain in my throat.
Really?
And I might say it incorrectly, but I sprained my trachea.
What?
Yeah.
I've never heard of
You've never, I know, I had never heard of that either.
Did you go to the doctor?
I did.
Oh my God.
Because I thought, and it was during COVID.
Just drinking water.
Just drinking water. And I thought I had, because I thought, and it was during COVID.
Just drinking water.
Just drinking water. And I thought I had COVID because it was during COVID. And all of a sudden I have this pain in my throat. I couldn't swallow. I couldn't do anything. I could barely talk.
Right.
And I'm like, okay, I got it.
I broke my throat.
No, I got COVID. I was preparing myself physically and mentally for having COVID. And I go to the doctor and they said, no, you actually hurt your trachea. So drinking water.
So how long did it take for you to heal? I mean, obviously they can't.
A couple of days.
They can't cast your trachea.
No,
so what happened?
No, just a couple of days and then it got better.
So were you able to eat and drink?
Painfully, yeah.
Sure.
Yeah, but so I've never had any issues with my ligaments in my tooth, but apparently my trachea has issues.
Maybe you should drink water fluids out of it with a straw.
Right, exactly.
Okay, everybody, back on task. This is why I love having Indi on, because we always get off, but we always laugh about, like, the stupidest things.
Yeah, I always have a funny story about
He does.
something.
Okay, here we go. So hyaluronic acid is an essential component of the periodontal ligament matrix and plays various important roles in cell adhesion, migration, and differentiation mediated by the various hyaluronic acid binding proteins and cell surface receptors. I told you guys it was going to be a little deep here, but bear with me.
It gets better.
Thanks. Guys, just bear with her, right? And then you like stick it out. So hyaluronic acid has actually been studied as a metabolite or diagnostic marker of inflammation in the gingival curvicular fluid, as well as a significant factor in growth, development, and repair of tissues in the periodontium. You need hyaluronic acid in your sulcular fluid in order to repair, rejuvenate, and replenish any form of the plaque and bacteria that's gotten below the gum line, and it actually aids in the prevention of periodontal disease.
Yeah.
Yes.
It does.
That's huge. So in the field of dentistry, hyaluronic acid has shown anti-inflammatory, antibacterial effects in the treatment of periodontal disease. So due to its tissue healing properties, it could be used as an adjunct to mechanical therapy in the treatment of periodontal disease. When we have patients that come in and we periodontal probe and we take all the x-rays and we diagnose them with periodontal disease, we do deep cleanings on them, scaling and root planing. We've talked about this before, to remove all that plaque and bacteria. So a lot of dentists now are using hyaluronic acid injected into the periodontal sulcus area after periodontal treatment to help aid in wound healing and to keep those areas clean while it's healing.
Very nice.
Cool, huh?
Very cool.
Yeah.
I actually should bring this up to my dentist.
You should.
I don't know if he knows about it.
I think we should send him the podcast. So after periodontal therapy, high levels of hyaluronic acid will act as a barrier or resistor to foreign bacteria while the tissue's healing. This allows the healing process in that environment. Hyaluronic gel is effective in controlling inflammation and gingival bleeding. So hyaluronic gel is great for gingivitis patients to prevent further progression of the gingival infection, which is nice.
Right, because as we know, it is an anti-inflammatory.
Right.
An antibacterial.
Right. So here's another cool one. Hyaluronic acid coats the oral mucosa, enhancing tissue hydration.
Right.
And accelerates the healing process. Hyaluronic acid maintains tissue hydration during periods of inflammatory processes such as periodontal disease, gingivitis, oral lesions, or any tissue injury.
Yeah.
In the area, like ulcers. Think of like those ulcers you get in the mouth. Those are painful.
Oh, absolutely.
Right?
And that is the difference between the hyaluronic acid used for dry mouth and other products being used for dry mouth.
Sure.
Because instead of just having that spray feeling like you're having water and then being gone in a couple of seconds, hyaluronic acid coats your mouth and maintains that moisture there.
Right, but it also reduces the plaque and bacteria, aids in wound healing, prevents periodontal disease. I mean, that's where you're getting and lubricates the oral cavity. Right, exactly. So come on, to me, that's a no-brainer.
That is definitely a no-brainer.
Right. It's multifunctional.
Exactly.
Which is huge. So a couple more, and then we're going to wrap this podcast up. Okay. So hyaluronic acid induces the production of pro-inflammatory cytokines. So pro-inflammatory cytokines are present anywhere there is an increase in inflammation in the body, and this includes your mouth, guys. So that's why I want to bring this in. Remember, periodontal disease, gingivitis, that means something's going on in your mouth and there's an inflammatory response. Hyaluronic acid helps aid in reducing that.
Exactly.
So let's just kind of keep talking about that. Hyaluronic acid also induces the production of pro-inflammatory cytokines by producing fibroblasts, keratinocytes, cementoblasts, and osteoblasts. So hyaluronic acid also induces the production of pro-inflammatory cytokines. And I know I said this a few times, guys, but hear me out. This means without the presence of pro-inflammatory cytokines, this will protect the periodontium from breaking down. Hyaluronic acid prevents periodontal disease.
Yeah.
Bottom line. Let's just say that, okay?
Exactly.
So this is one last one, and I actually wanted to say this for the oral health. I think it's kind of cool. Do you have TMJ pain? Do you ever get like TMJ or jaw pain?
No, actually no. But I've worked with some doctors or dentists that are specialized in TMJ.
Right. So they are, remember we talked about into the joints in the body where they have bone on bone?
Yeah.
They're using hyaluronic acid injections into the temporomandibular joint.
Oh, wow.
Yes.
Okay.
To help alleviate that pain.
No
where
kidding.
people have that TMJ disorder.
That's interesting.
It's crazy. It's great.
That is interesting.
I'm like in love with hyaluronic acid right now.
Yeah.
So I just have to say that.
Yeah.
So what do you think?
I think it's great. I really think it's great. Same with you. I mean, I knew a little bit about hyaluronic acid and some of the benefits that it provides, mostly for your oral care. I mean, the fact that some of the information you brought in today, it's amazing.
It is.
And it opens your point of view in a lot of things.
Well, it does. And it's interesting because now when I buy products, oral health care products, skincare products, things like that, I do look for that as an ingredient.
Yeah.
I focus on that now. I say, okay, does it have hyaluronic acid?
Right.
Because I know firsthand after doing all this research that all the oral and systemic health benefits, not only does it aid in dry mouth, but it prevents and aids in preventing gingivitis and periodontal disease.
Yeah.
Wound healing, that's huge.
Yeah.
It's amazing.
Cell generation.
My gosh. What's
I mean, that
next?
was the one that got stuck in my head.
The cell regeneration.
The
cell engineer. Tissue cell engineering.
Yeah.
Yeah, so that's crazy.
That is crazy.
So I think that gives people hope, who have systemic health issues,
Exactly.
diabetes, surgeries,
right.
burns.
Burn victims, yeah.
Sjogren's disease for dry
Sjogren's,
mouth, dry
absolutely,
eyes.
yeah.
It's fantastic
It
to
is.
know that this is great. So, everyone listening, I know you got an earful of information today on the latest and greatest hype of hyaluronic acid and all its beautiful and amazing benefits for your whole body. It truly is nature's lubricant. So let's end this podcast on a great note. It is important to maintain moisture in the skin as well as hyaluronic production in the body as we age. We need to make sure we're getting adequate hyaluronic acid into our body to maintain healthy joints, glowing skin, and moisture where it's needed in the body. Oh, and don't forget all the great oral health benefits too. Indi, thanks.
Thank you,
Thank
Sarah.
you for coming again.
Thank you. It's always a pleasure, and looking forward to our next podcast.
Yes.
I'm sure it will be a lot of fun.
Yes.
Yeah.
I'm definitely going to have you on again.
I appreciate it. Yeah, I have fun too, and I want to congratulate you.
Thank
to be
you.
honest, I think you've done so much.
Thank you.
And you started this podcast with an idea in your head, and I think it's gone. And right now, it's a lot more individuals are listening to it, are learning from your research and some of the studies that you have done.
Yeah.
So I think you're doing a great job.
Thank you.
And I am glad to be part of your...
I appreciate
Yeah,
that.
of course.
That was lovely. Thank you so much. And I have to say I appreciate your time coming on and being a part of it because, I'm learning all this stuff, but think about all the cool stuff you're learning. And most importantly, we're educating people as well,
Absolutely.
too. Because, when we know better, we do better. And when we
Absolutely.
do better, we feel better. We know that. So thank you so much for
Of course.
coming.
Thank you. Have a great weekend.
You too. And everybody, thank you so much for listening and stay tuned for our next upcoming podcast.